I request all the speakers to please come on the panel. We'll take up questions. There are several questions that have already come in. So let me begin by asking the first question, which has come from a very senior dietitian, Madhu Sharma. Madhu, thank you for your question. This is on gluten-free diet. So I guess Shilpa will be answering this. Your take on gluten-free diet in thyroid patients. Many are being advised to avoid thyroid in hypothyroidism. Can you please take that?
Gluten and hypothyroidism. Again, if we actually look at the RCTs, randomized clinical trials, there aren't any. We know that we live in the era of personalized nutrition. And in one of the patients, if, removing gluten from the diet actually changes their weight or it betters them, then it should be done. But holistically, there is no data to show that avoiding gluten actually helps hypothyroid patients or get their numbers better.
Okay, thank you, Shilpa, for that short and crisp answer. There's another question. What about dairy-free in PCOS females as advised by many dietitians? Shubda, would you like to take that?
Not there.
Is she here?
Subhada, she's not there. She's not there.
Okay.
Okay, would anyone else like to answer since she's not here?
Can I take it?
Yeah.
Yes, please.
I don't want to dominate the session. Hence, again, the same thing. If you look at the RCTs, there is no conclusive data that not having dairy is actually helping. But in real life, we see a lot of PCOS girls doing far better when dairy is minimized. And probably that can be because of the saturated fat present in the dairy. We do not know, but there isn't again anything conclusive to say that if you stop dairy or to restrict dairy in women with PCOS, they do far better.
Thank you, Shilpa. The next question is from Pooja Manoj. Her question is to Seema. Is cinnamon cassia hepatotoxic?
If it is taken in low dose, then certainly not. See, the study that we conducted, the intervention was given for 4 months and the dosage was 3 grams. But what I said, that indiscriminate use for a prolonged period of time, people think that cinnamon is healthy, they keep on taking for years or, for months together. So that can, there is a study on animals, like a rat study, which showed that there was some hepatotoxicity if the heavy dosage is taken. But of course, that was reversed within 120 days or so. But yes, we have to take caution with large doses, and for spices should not be taken in heavy dosage for a prolonged period of time. In normal dosage, definitely no hepatotoxicity.
Okay, Seema, please stay on because the next question is also for you. Madhu Sharma would like to know if there's any difference in outcomes by using cinnamon hand pounded versus the ground form using blender. Some studies have shown better effects with using cinnamon without exposing to heat from the blender.
Yes, definitely, because polyphenols, there is some loss of polyphenols when we are, using a hand blender. So what we advise normally to patients that, they can have an ice pack around the blender so that, the temperature is maintained. For this study, we had used a pulverizer, but it was a temperature control because it was in controlled conditions. We could maintain that. But normally, yes, if you are using for, everyday purpose, hand pound is definitely better. And if you're using a blender, try to control the temperature by some ice pack or something. Yeah.
Okay, one last question on the chat box is from Dr. Kishore Jumani. Again, for you, Seema, is salt also included in spices?
No, because the salt is a seasoning. It's a seasoning. It's not a spice. It's not a plant derivative. As I said, that is a stem, root, or a seed of a plant is a spice. So it's not a spice. It's a seasoning.
Thank you. There are no more questions in the chat box, but we still have about 13 minutes left. So if anyone would like to ask questions, maybe even the speakers would like to ask each other questions, you're most welcome to. I will hand over the mic to Dharani and Salome to take this forward.
I have this question for Seema Gulati. Can I ask?
Yes, please.
Don't mind.
Hi. So I wanted to ask that since your paper came out on cinnamon, cinnamon has become a sort of a prescription in weight loss or diabetes management diet. And what happens is patients sometimes follow up, sometimes they fail to follow up. And they sort of keep following that same diet sheet, you know, I
Years
think
together.
infinitely or whatever. They try to, and people are very interested not in the bigger part of diet, but when you tell them to have spices or you tell them to have nuts, that is something that they keep with them, you know, even if they don't follow the other diet. So should there be sort of a guideline given to all the patients saying that, you know, after 3 months, stop doing this because it's going to bother you, or what do you suggest?
100%. 100% we tell them, that first of all, we have to tell patient that there's no magic pill or there's no magic food item. People are generally looking for shortcut solutions. Okay, I'll have cinnamon, that's it. So we have to educate them that there is no such food item, whether nuts, as Cheryl said, or any other food item, that if you take that and you are all done. It has to be part of a healthy diet. It is the dietary pattern which is important, the overall diet that we are consuming, and also that the way you are taking medicines for a specific period of time, same way, because this is heavy dosage of spice. Normally in day-to-day life, we are not consuming 3 grams of cinnamon. So it's a heavy dosage. It has to be for a prescribed period of time. And after that, definitely we have to tell them that no, now you can include cinnamon in your diet, as in you can sprinkle it on your fruits, or maybe in your smoothie you can add a little bit, but not at this dose. We definitely have to give them these guidelines. And in our study patients, we had certainly we were very particular about it. Yes.
Thank you. There is a question here, which type of millet should be taken? Timing or consumption, timing of consumption.
Yeah.
Anybody there? Yeah, Dr. Sudha.
Yeah. Like any balanced diet, we talk about variety. Fortunately, we have variety of millets available. So it's definitely any bag of millets, but millets by and large should be properly accompanied with the appropriate amount of legumes. So that is a way forward until we find developed market products combined with lower GI millet-based products. So if it is a homemade, I think it's a good idea to have. There's no timing. Wherever millets are traditionally eaten as a meal in place of rice or wheat, those dishes should accompany. For example, in the CGM study, we tested the ragi balls with legumes. Though ragi ball showed very high GA, when we added chenna gravy along with that, it blunted the postprandial excursion brilliantly. So that is how one should combine to reduce a glycemic load of the meal by combining with that. So that's the way forward with millets.
Thank you, Dr. Sudha. There's one more question here. I think for seed cycling in PCOS, anyone can comment?
There is no evidence on seed cycling. We don't have evidence. However, incorporation of nuts and seeds does help in PCOS. And therefore, we do have to, we can recommend them to take it, but we do not have any evidence on seed cycling.
Thank you, Cheryl.
I'll just add on to Cheryl.
Yes, please.
The nuts are very well known for satiety promoter. So
yes.
People think that, PCOS is very closely associated with obesity, and women make the person to shed weight. So if anything that improves satiety and make them reduce intake of food and energy, I think that way probably nuts, but really not shown like what Cheryl said. Studies are not being clear yet.
Exactly.
And also it will cut down the carb consumption, because, and again, the same thing, with these young adolescent girls, we see a lot of unhealthy snacking, especially in the evening. So just replacing that with nuts and seeds, I think that would help.
Yeah, and I would like to contribute here, ma'am, because PCOS the nuts have very high amount of phytonutrients, and PCOS is a kind of inflammation where phytonutrient and bioactive components like lignin and all which are present in them helps you to work better on anti-inflammatory aspects and insulin resistance.
Absolutely.
Yes. Thank you so much, Geeta and Cheryl.
Ma'am, one more thing, if I can add here, is
Cheryl.
that, flax seeds, I see a lot of people just sitting and eating flax seeds because they think it's good, so they actually take it in a box and they'll keep eating it. So again, we have to tell them that they're calorie dense, and flax seeds, the best way to consume is to lightly roast them, powder it, and then consume rather than having full, whole, so that it gives you better health benefits. That's what I want.
Thank you, Cheryl, for your inputs. Subhada is there?
No, I don't think so, ma'am. She's in our OPD.
Okay, there's a question on cow's milk intake relation with type 1 diabetes. Yes, Cheryl.
Yeah, so we've done a lot of review of literature, and there's nothing concrete to show. We don't have any evidence to show that cow's milk causes type 1 diabetes.
Yeah, it's still an hypothesis. Yes.
Cheryl,
in milk,
can I just ask something?
Yes.
What about alsi, which we see in Gujarat, and flax seeds? Are they the same? Is a big question.
Yes, ma'am, it's the same. It's called adusi in Gujarat.
Okay, but they are smaller, isn't it? It's just a different.
It's the same, ma'am. It's similar.
Because I saw in another, somebody had said it's different. So
no,
that's
ma'am, it is the same. In fact, chia and sabja are different. A lot of people, they have sabja instead of chia. They think it's the same, but they are different.
I may just add on with flaxseed.
Yes.
See, the flaxseed, the fatty acid content is very, very volatile. So the Rajasthan claims the best content. So people need to think about it, how to store them and use them.
Yes, true.
Only as and when needed, it has to be taken. And people store it in dark bottles. It's photosensitive. It's very, very unstable long chain fatty acid. So that has to be kept in mind.
We tell them to usually store it in a container in the fridge and then consume it. That's what.
And within a week.
Regarding milk, I have a comment to make, because I was going through the vegan diets and I have a lot to talk about bioavailability of the calcium. Insulin growth factors are related to milk somewhere, and there are a lot of researchers now promoting milk as a support for insulin growth factors. And that is why quantitative approach towards milk is very important when you talk about insulin resistance, when you talk about weight management, because the saturated fat, the insulin growth factor, tries to work on your adipogenesis, and which invertly, I think, tries to worsen your sugar and weight management. I think that's another aspect of milk which we should be looking at to the research point.
Thank you.
I think, Geeta, that's a good point. I just want to add there is, if you look at, because we see a lot of patients from other countries and they're actually restricted to not more than 200 ml, because here people have a lot of milk. Sometimes even we've got people consuming 1 liter of milk in a day. And so that is something that we, when we are counseling, we need to take into account how much they're consuming.
Yes. Can I just, for a discussion, like when we roast seeds and nuts, it is also evident that the uric value goes down and the advanced glycogenase reduces. So in spite of that, Cheryl, you are telling the flax seeds to be
Ma'am, it's only, but very lightly.
Roasting, exactly.
Very
so
light. That's what I mentioned.
Should be very clear. It should be just very lightly roasted, and even that will reduce the early rancidity of the seed.
Ma'am, and that's why I mentioned in my presentation, when it comes to nuts, it should be raw and salted. If you look at all the studies, whether it's Sudha ma'am, Seema Gulati's, as well as ours, we gave raw nuts. It was not roasted and it wasn't even soaked. It was just raw nuts that were given.
Yes, washed and just eaten.
Not even washed, ma'am. Raw nuts.
Nowadays we can't help it.
We don't. In fact, walnuts, in fact, they say if you soak, you lose out on the polyphenol. So that's why they do not advise even soaking.
Walnuts are shared, but almonds needs to be washed because we purchase it from a local market, and I don't think how.
In our study, we gave raw nuts. We did not wash it. We gave it as it is because they were nicely, put in pouches, and that's what.
And what is your take on soaking of almonds, which is very common up north? And people remove the fiber. They're wasting it literally.
Ma'am, it's a very good point. In fact, when we did the study, we did it with California Board of Almonds, and I think Seema can also add to this. And they very clearly said that you should not be soaking it. It has to be taken raw. So
that again, I think, is because of the polyphenol content.
Yes,
in almonds.
You lose the polyphenols.
Yes, you lose the polyphenols.
But there is one study from Pakistan. There is one study from Pakistan which shows consumption of soaked almonds, led to improvement in HDL levels. Because you are getting rid of the phytates and oxalates. That is also there. So it's like it's a area for research. We are working on it. So
I think that will be excellent.
Till then,
there's a question.
Yeah.
Sorry, you finished. Sorry. I thought you had finished.
Till then, the guideline is have them raw and have them, you can grind them. Mastication is very good. The more you chew nuts, the more beneficial effects you'll get, because the cell wall breaks and there is release of nutrients. So they have to be chewed properly. And as Cheryl said, unsalted and raw nuts are best.
But this definitely calls for research on this, because even we are clueless what to tell our patients. Because, we used to always say, like, Salome ma'am said, to soak and then consume. We used to always tell our patients to do that till we actually interacted with California Board of Almonds and the California walnuts, where they said, no, you should be taking it raw.
But if you look at the comparison of polyphenols and the benefits of soaking, which reduces phytates and improves the bioavailability of other micronutrients, I think soaking scores over the polyphenol content. So I think that is something
I think this is a good area of research for sure.
Debating, I think we should have a fantastic debate on
we should have more research in this area, because I think that is the need.
Yeah, there's a question here.
The data in Predimed trial, the data in Predimed trial, the part of Mediterranean diet, the nuts were unsoaked.
Yeah,
they were
in all studies, ma'am.
I think most of the studies are
all the studies so far. They are unsoaked.
It's
just one study that I mentioned in Pakistan.
On top it up, phytates are not easily water soluble to go away. Like we always rinse and wash our rice and things. They are not that easily removable with plain water wash. Yeah.
True. Yeah, Sudha ma'am, I think you should look at doing a study on this.
We have last 2 minutes left. So
okay, there's one question in the chat box. Dharini is trying to.
Yeah,
there's a question in the chat box. Dharini, go ahead.
Yeah, sorry, I've been trying to ask that. If you powder flaxseed, will it not break omega-3 bonds? Dr. Vijay Surithlikar is asking.
I don't think so. You have to lightly roast it. It's supposed to be lightly roasted and powdered.
Yeah.
And then consumed, because that will give you more health benefits, because that is why you're having it, consuming it.
Okay, thanks.
Okay,
Shilpa, the timer says
question.
18 seconds.
Yeah, 15 seconds.
Shilpa, we can have active discussion.
So last 18 seconds, any comments from
the
chairpersons?
One question, ma'am.
Yes.
What is the role of dairy in autoimmune or inflammatory diseases? Like, it is not advised or advised. What is your take?
Can I answer this?
Yes, please.
So from our cure study, we have published against the Western philosophy of dairy. See, the dairy that is produced in India, the milk is very different from the rest of the world. Okay, if you take an American milk, it's very different. So milk has got higher insulin index, they have reported, but we don't have data now. We are currently working with Anand, the Verghese Korean Center of Excellence, a new project. We are working on that. And we have shown even with the 3% fat milk, both fasting insulin, HOMO-IR, and type 2 diabetes risk all definitely inversely associated. So to us, even up to 400, 450 ml of milk per day has shown a positive, good effect, health benefit. So this is what is very critical. Even the same pure study with 21 countries, including India, showed this. So we seem to have a different story coming from milk that is made in India. So I think we have to wait till to find out our milk insulin and glycemic index. We are trying to see fiber fortified milk and curds. Fiber is something that is missing in milk. Probably that will still reduce the insulin index of milk is our hypothesis testing. We have just commenced the project. Hopefully, probably next year around, we should have more results to share with this group.
Quick question, Sudha, was it full fat milk or skimmed milk?
I'm saying 3% milk is considered as a full fat. Full fat milk. 3% is full fat. Yeah.
Thank you.
Yeah.
Thank you, Shilpa. Over to you.
Thank you, Shilpa.
Thank you very much.
Thank you for giving the opportunity, Shilpa.
Thank you all.
Thank you, Chairperson, Shilpa,
everybody. It was indeed
excellent.
a very enlightening session.
Yeah.
Thank you so much.
Wonderful. Thank you very much.
Thank
to
you.
all of
Thank
you.
you.
All.
Thank you.
Bye.
Bye-bye.
Bye.
Great. Thank you, Dr. Shilpa, and everyone for such a wonderful and interactive